Hi, good afternoon. My name is Dr. Khan. I'll be seeing you today. Have a seat. What's your name?
Hi, Doc. My name is John Smith.
Okay, Mr. Smith. Nice to meet you. And what brought you to the office today?
Well, Doc, I have a little problem down there. I could talk to you about it.
Yeah, of course. I mean, I know you're probably feeling uncomfortable, but as a doctor, I see patients all ages, all kind of complaints. I've seen it all, boy. You go ahead. What's going on?
Well, Doc is real sensitive. You see, I don't get for the last 2 months I can't get an erection, and it real affecting my sexual life and my relationship with my wife. And I try all kind of things, and I need medical help. That is why I come here. This was my last resort.
Oh gosh.
Help me with that.
Yeah, boy, that's a serious thing. I'm real sorry to hear that. Well, I need to ask you some more questions to understand what's going on, right? And, some of these questions might be a little sensitive, a little personal, about the bedroom life and thing, and, about down there. Are you okay with that?
Yeah, no
Yeah.
problem. Yeah, you go ahead.
Okay, so tell me more what's going on. Okay, so you get in trouble 2 months now to get an erection, and tell me exactly like when, are you able to have penetration or anything like that, or
No, it I can't get an erection. It's just real soft, and I don't want to even try to put it in, if you know what I mean,
right,
because
right,
I'm
right.
just real embarrassed, and I can't even have intercourse right now
Oh
because
gosh.
yeah.
Yeah, and how's your wife handling this?
Well, Doc, to be honest, that is really why I come here, because I feel like she think I do love she, and I try to hide this from she. The problem,
Uh-oh.
I feel like I can't do it anymore. So I really want some help.
Yeah. Don't worry, we'll help you. We'll figure this out together, right? So, um, you tell me what anything major happened in your life 2 months ago? Anything at all?
To be honest, Doc, a little bit before this problem happened, I get demoted in my job now, and
Mm-hmm.
I was used to a certain kind of lifestyle, and I can't live that lifestyle, that level anymore. I seen
Mm-hmm.
bills piling up, and it causing me some mental stress. And um, I don't know if that is what causing it. One of my partner tell me it's stress, boy, it's stress. So, but I don't know. I didn't know stress could really cause that bedroom problem too.
Yeah, because that.
Yeah.
Um, so you still getting like erections on a morning and thing?
Yes,
Mm-hmm.
to be honest, yeah, I could, but when I wake up with it, but it will go away fast and thing. Yeah.
You try all kind of thing. You mean like the pornography and thing, or?
No, I do watch that and thing. But like little bush medicine and thing now, a wonderful world, um, aloes and beets. They do them fellas tell me to try, but
Yeah.
nothing really helping.
Mm-hmm. Well, besides your wife, you have any other partners, any old friend, anything on the
No,
side?
no, no. I'm a loyal person though.
That's good to hear, man. You ever had any infection and thing before?
Infection.
HIV and thing, like, them
Oh,
kind of
like
thing.
STD? No. Mm-mm. Not that. I don't do them. I had none of that. Yeah.
Okay. And you notice anything strange about your penis? Anything abnormal in the shape or color?
No, no.
Any discharge coming out? Anything?
No, don't get normal doc. No discharge and it normal shape. Yeah,
Oh,
normal size, everything.
right. I'm going through your notes and I see whether you're diabetic, you're hypertensive, you're taking your medication. What's going on with those? What's going on with that?
Yeah, since I go in clinic 10 years now, I don't miss my medication, my pressure tablet and sugar tablet. I just take that religiously. Yeah, I
Right. When I
miss
see
that.
get some like I check with blood test something. When I say do the test to check for the how to see if diabetes going. When I say do that.
The last time I checked, I asked the doctor, I was about 6 months now, and they said that the sugar control was 7%.
Okay, that's good. That's good. And how the exercise and thing.
Exercise, I do my gardening and thing, and I try to walk for about 30 minutes and thing 2 to 3 times a week, depending on how the weather and thing going. I
Right.
just stay fit. I just try to stay fit.
Yeah, and you just smoke and thing.
It'll talk, yeah, one cigarette, like two, three a day and thing.
How long are you doing that?
about 10 years now I pick up the habit.
But you know that does really affect men having an erection and things, especially at this age, you know. You gotta cut it out.
Don't make joke now, dog.
Yeah, you feel able to do that?
I could do that. I could do that because me addicted to it. I just when I like with them boys on them, I just take my little thing.
Yeah, we
And
can
so
help with that too. Don't worry.
yeah.
So what about the drinking? You drink
Nah,
alcohol?
not really. I'm not a drinker. I can't remember last time I had a drink, to be honest. I don't like the feeling. It is too
Mhm.
much. So I can't remember last time. Drinking is not a problem.
Hmm. You was sick anytime recently? You was hospitalized for anything like that?
No, mm-mm.
Any previous surgeries?
No, no,
Yeah. Besides the medication you're on, you're doing any other kind of drugs and thing, marijuana, cocaine and thing?
mm-mm, no.
Nothing like that? Yeah. What about any family, any major medical problems and thing?
Well, my father had pressure too, and he died with a heart.
Mm-hmm.
But I think she had diabetes, but she died with old age. But other than that, they really have no other problem like this in the family.
Mm-hmm.
Mhm.
Have anything else you want to tell me? Any other medical problems you having? Any other issues? Something besides what you came for today? What you're
No,
telling me? Sorry.
it's just really this dog.
Yeah. All
Yeah.
right. So let me tell you what I think going on. So I think the stress, you're under a lot of stress, right?
Mhm.
Um, so the plan is I want to get you a little counseling if you're okay with that.
Yeah, I'll be okay.
What do you think about that? Yeah.
Yeah, yeah.
Yeah. Right. So the counseling will help with the bedroom life, help you ease with the stress. And you're under a lot of stress. I mean, there is real stress you're under. Help you with the anxiety, help to cope, they'll help with strategies in the bedroom to help, um, how to do some other blood tests, something. I know the sugar under control, but I want to check the liver, the kidney, do a little blood count, make sure everything in order, right? I don't know if you ever heard about Viagra.
Yeah, I hear about that.
Yeah, so was everything in order? We could try that and see. Now, that is a medication. You take about 30 minutes to 60 minutes before intercourse, right? Um, so once everything in order and you're in pretty good shape so far, but I want to do a full checkup. I want to do a physical examination, right? I'll ask Ines to come in after we finish here and we'll do a little examination at the genital area, right? While we're talking about it, you ever had any accidents or any injury to the area, the pelvic area around your genital, your back, up?
Nah, down there, no, no, no injury really.
Right, right. Okay.
Not
Well,
recent.
yes, so that's the plan. So I want to examine you. Want to do some blood tests, want to get some counseling. We could do a little trial of the Viagra and see how that goes. Right. And what you think about it?
Yeah, well, the counseling is me and uh, one counselor is just like that. Oh,
Yeah, it could be one counselor, and if you're comfortable to carry a partner and stuff, and she could express her concerns too, and they'll help you all as a couple, yeah, and you as an individual too, more for the stress and how to handle it and so forth, right? Um, yeah, so that's basically the plan. So you understand what's going on with you, right? So the term for what happening to you, the medical term is called erectile dysfunction, right? That's a medical term for basically not be able to get an erection, right? There are many causes. Infection, trauma, like when I ask you if you get any injury and stuff, right? Medication. But in your case, from what you're telling me, it's looking like the stress really affecting you, right? So that is psychological problems, right? So those called psychogenic. Now I'm gonna give you a little website. I don't know if you're familiar with Google and thing. You know,
yeah, yeah, yeah.
yeah, and I want you to go and read up a little more on it so you can understand what's going on. It will help with the embarrassment, anxiety, and all that. You'll understand is a very common, very, very common problem with men in your age, right? Um, and so far, I'm glad that you have the diabetes and thing under control because that's be a big problem too if it's not controlled. And we
Mhm.
had to ease up on the smoking, right? If you get in trouble with that, I could also refer you to somebody to help with that, right? The
No,
smoke.
no, I could give up that.
We'll take it one at a time, right? So let me do the blood test something and if you're okay with that, you have any more questions for me, anything you would like to tell me?
No, no, I okay, doc. I think I understand what you say. You say to get counseling, we do the blood test and we could try the Viagra once everything okay. That is it,
Yeah,
and
yeah, that's the plan, man. So Don't worry, you see, we'll sort you out, right?
Okay, yeah. Well,
Right,
thanks
nice
a lot,
meeting you,
Doc.
Mr.
Yeah,
Smith. So I'm gonna call the nurse and we'll do the examination, all right?
yeah, no
You,
problem.
all right, take care.
Okay, yeah. Thanks.